to thank the Cancola for accepting my topical issue, and I thank the Minister for help for coming into the Chamber. Recently, parents of children in my constituency on orthodontic waiting lists for treatment at the dental clinic at Ashtown Gate, Navan Road, have been notified that they may transfer to the waiting list at the orthodontic unit in the Louth County Hospital in Dundalk. This would involve not only considerable travel costs, particularly as orthodontic treatment can involve several return visits to the dental clinic, as well as the amount of time that it would take for both the child and an accompanying parent. I will read a letter that one of my constituents received last week, and I think the tone of the letter is interesting. The letter is from the orthodontic service in the HSE at Ashtown Gate, Navan Road. Dear parent or guardian, we are now in a position to offer Jack an orthodontic treatment place in the orthodontic unit, community care building, Louth County Hospital, Dundalk, County Louth, if you are willing to travel to Dundalk for the duration of the treatment. Please note that Jack's complete orthodontic treatment will take place in Dundalk, and patients who commence their orthodontic treatment in Dundalk will not be able, under any circumstances, to transfer back to the orthodontic unit at Ashtown Gate. If you accept this treatment place, Jack's record will be forwarded to the orthodontic unit in Louth County Hospital, and the orthodontic staff in Dundalk will be in contact with an appointment by post within the next 4 to 6 weeks. Please confirm if you wish to avail of this treatment place in Dundalk or remain on the waiting list in Ashtown Gate by completing the section below and returning to the above address. I cannot give you the waiting time for orthodontic treatment waiting list in Ashtown Gate. Please respond immediately on receipt of this letter, and that's underlined, no later than 2 weeks from the date at the top of this letter to indicate your preference for treatment. Please note a complete orthodontic treatment typically equates to approximately 30 to 40 visits to the orthodontic unit in Dundalk over a period of 2 to 4 years. It is imperative that you attend all of these appointments punctually. Failure to do so may result in you being removed permanently from the orthodontic list. Signed by the manager of the Orthodontic Services, Dublin North East HSE. Can I just say, I think the tone of this letter is interesting. Effectively, it's putting a gun to the head you either go to Dundalk or else you may not get orthodontic treatment if you remain on the Ashtown Gate waiting list. And as Jack's parents found this notification disturbing, I wrote to the Director General of the HSE asking him to review the orthodontic clinic location for children in the Dublin city north of the Liffey and find a more convenient location for a dental clinic. Today I received a reply from Mr. O'Brien's office telling me that my correspondence has been referred to the HSE Parliamentary Affairs Division. Frankly, I don't think this response is good enough, and this is the reason why I have sought to raise this matter for debate here as a topical issue today. I would ask the Minister to urgently intervene with the HSE to find a more accessible orthodontic health treatment clinic for the Dublin region north of the Liffey. Thank you.
Thanks very much. I wish to thank Deputy Kenny for the opportunity to address the issue of orthodontic services. I'm taking this debate on behalf of Minister Kathleen Lynch, who's attending to business elsewhere. Orthodontic treatment is provided by the HSE to patients based on their level of clinical need. The HSE provides orthodontic treatment to those who've been assessed and referred for treatment before their 16th birthday. Patients are assessed by the HSE Orthodontic Service under the Modified Index of Treatment Need. Patients with the greatest level of need are provided with treatment first. The HSE endeavours to provide patients with services close to where they live. Occasionally, where there is capacity to provide this treatment sooner in another centre, this option is offered to patients. In this way, patients on the waiting list who live in Dublin may be offered treatment in Louth County Hospital in Dundalk. Should they choose to not avail of this option, treatment will still be provided for them in Dublin. Most patients, approximately 75%, who are given the option, accept it. At the end of the second quarter of 2014, a total of 23,982 patients were in treatment. There were 6,658 awaiting assessment and 16,518 awaiting treatment. Patients with the greatest needs are given priority. Nevertheless, long waiting times for orthodontic assessment and HSE and treatment are a matter of concern for the department and the HSE. The HSE commissioned an independent review of orthodontic services in 2012. The key issue highlighted by the review, which has assessed services nationally, is that the orthopaedic service should be fully integrated with the primary care service. This will be implemented as part of the HSE wider reform programme. The HSE has also recently established a pilot scheme which will involve the use of orthodontic therapists. The HSE Dublin North East D&E Orthodontic Service has been chosen as the pilot area for this new and innovative training programme. One member of the dental hygienist staff and one member of the dental nursing staff commenced this training back in September. During the course of the training, these students will work under the direct supervision of a specialist orthodontist currently working in the HSE units and in the Dublin North East region in the treatment of a select number of children eligible for the HSE-funded orthodontic treatment. In addition, over the next 3 years, orthodontic treatment for certain categories of misalignment will be provided by a panel of independent practitioners under contract to the HSE. The tender process is currently underway and is due to be ready for commencement in 2015. It's expected that these changes will have a positive impact on waiting times and on the services available to patients. I have a copy as well of the standard letter that is sent out to patients which your constituent would have received. I suppose the only thing that I would find wrong with the tone in it is that it doesn't give an indication as to where they are in the waiting list for Ashtown Gate. If it did, at least parents could make an informed choice as to whether they want to wait it out and go to Ashtown, or whether they would prefer not to and go to Dundalk. And I'm familiar obviously with Ashtown Gate very well, being the service that serves my own constituents. Indeed, it's located in my own constituency. It isn't practical or appropriate really for me to start deciding where clinics should or should not be located for reasons which the Deputy will no doubt appreciate. But the reason why this policy is pursued is really for a very good reason. In the HSE Dublin Mid-Leinster area, there's only one person waiting more than 6 months or more than 7 months for assessment. Yet in the Dublin North East area, there are 556 children waiting between 6 and 12 months for assessment. So if it's not possible, or if we don't have the resources to bring the waiting list down everywhere, does it not make sense, and would it not be fair to at least allow people who live in an area where there's a very high waiting list to choose to transfer to an area where there's a very low or no waiting list? And that's what this is being done. It's an attempt to provide a bit of equity across the regions so that people don't face excessive delays just because they happen to live in the wrong place.
Okay, thanks, Minister. Deputy, further 2 minutes.
Yeah, thank you, Cahill, again, and I want to thank the Minister for his response. I mean, as the Minister has said, the letter from the HSE doesn't tell the parents of Jack where he stands in relation to the Ashtown Gate waiting list, and I should say they can't make an informed decision as to whether to, if they thought it was sooner, if they thought they could get the treatment sooner by going to the doc, perhaps that would change their attitude. But the problem really is the parents of Jack. The father is in a full-time employment. Jack's mother is a person who has an illness, suffers from Crohn's disease, and it would be difficult for her to travel with her son to Dundalk, and obviously we're told it could require 30 to 40 visits to Dundalk. Now, it's quite expensive. Train fare, return fare from Kilbarry to Dundalk for a child and an adult, 30 or 40 times would amount to quite an amount of money. And there is also the question of Jack's mother's own health. So I don't think the policy of the HSE is really focused on the needs of the particular client and the client's family. And as the Minister has pointed out, there is no information in the letter as to whether they'd be better off remaining in Ashtown Gate. The implication in the letter, clearly, in my view, is that they would be done quicker if they went to Dundalk, but it doesn't say that. And in the absence of that sort of definite information, the family are in a quandary, and to have to go to Dundalk for 30 or 40 visits would pose difficulties for the family. So, you know, and that is the point that I'm trying to raise. I am disappointed with the Director General of the HSE who didn't take up the points that I made, and he just simply referred it on to somebody else. But I would appreciate it if some way could be found to persuade the HSE to give more information to children like Jack as to whether they'd be better off staying on the Ashtown Gate list or whether they would be done a lot sooner by going to Dundalk. Thank you.
Okay, Minister.
Actually, the figures that I gave the Deputy earlier relate to the time it takes to get assessed. And actually, in HSE Dublin North East, it's better than in Dublin Mid-Leinster, so you get assessed quicker in Dublin North East. but your treatment or getting to treatment is slower. And of the 4,000 cases in HSE Mid-Leinster, only 87 are waiting more than 2 years, whereas of the 3,786 cases in HSE Dublin North East, there are 748 waiting more than 2 years. But I think the Deputy's point is well made. It's right to give people the option to travel a certain distance to get better treatment, but at the same time, we should allow parents to make an informed choice as to how long they may have to wait if they don't accept the offer of going to another location. And that is something I'll certainly take up with the primary care section, or dental section rather, of the HSE. I think that's a very fair point. I would also point out, though, that you know, no matter where you draw boundaries, there's always going to be some sort of issue, as we all know very well as politicians who deal with constituency boundaries. And there will be people who actually live, for example, in parts of Meath, who are just as close to Dundalk as they are to Ashtown Gate. And when they, for example, get the offer to go to Dundalk rather than Ashtown Gate, it may even be convenient for them, in fact. So that, I suppose that's just the nature of boundaries in catchment areas.